Professor and Head, Department of Kaumara Bhrutya, that is Pediatrics, Government Ayurveda College, Hospital for Women and Children, Trivandrum. A PhD scholar in childhood autism from Kerala University with 16 years of clinical experience in managing autism and related cognitive and behavioral disorders. She's also working on research projects on autism in collaboration with the Rajiv Gandhi Institute of Biotechnology and Center for Disability Studies, respectively. She was also part of the Snehadhara project founded by Trivandrum District Panchayat for providing Ayurvedic treatment and complementary therapies to children with developmental disorders. Let us welcome Roshni Anirudhan to speak on Ayurvedic management of autism.
Namaste. A very happy good evening to one and all. Before starting upon the Ayurvedic view or Ayurvedic management of autism, let me share with you how we Ayurvedic people are viewing the concept or disease autism. So I'll just brush upon the common features. You all know that some social interaction issues, communication problems are going on with these kids, having some adapting disabilities and all. So thinking behind the biology of these clinical features, what we are concerned. We are aware that many of them are having a strong genetic background, which is causing or which is responsible for functional derangements in the brain. And many metabolic functions are deranged in these kids, and the involvement of the immune system is also evident from many of the researchers, and many environmental factors are proven to precipitate these comorbidities or symptomatology of autism. So, evidently many studies have come up with CNS, central nervous system pathologies like migration errors, some structural abnormalities in the hippocampus, amygdala and all. Then mini-column hypothesis is there, and motor neuron system abnormalities, mirror neuron abnormalities are there. Anyway, we are coming to sum up like, even though our main concern is psychological abnormalities like behavioral issue, social interaction deficits, and communication deficits, evidently there is a somatic backup for these psychological issues. So, parallel to the psychological issue, or hidden, there is a somatic issue. Or in turn, I can speak in a level that we should be in a doubt that whether this somatic issue is causing a psychological disturbance in the kid. So, evident somatic issues are the central nervous system abnormalities, then gastrointestinal tract abnormalities, metabolic errors, the defective gut-brain axis, and oxidative stress, and so on. So, in an Ayurvedic platform, we view autism as a psychological abnormality having a strong somatic background. So, we believe that without correcting that somatic error, we are unable to manage that psychological abnormality. So, healthy mind in a healthy body. So, our concerns in an Ayurvedic platform. We have a concept of Agni. That is the main power of metabolic power which is working in every individual, and that Agni is responsible for all the digestive and metabolic activities happening in each and every person. So, this Agni, most probably it is having a defective genetic backup, so which is causing an impaired metabolic functions in utero and after delivery, after birth also. So many of the metabolic functions are getting impaired, and there is an accumulation of this metabolic waste in the system. So in our terminology, I can call it as ama, or as it is functioning as a toxin, or it's a waste, it's a metabolic waste. We call it as ama visha. Why? Because it functions like visha or toxin to the body. So we call it as ama visha. So this metabolic toxin with a genetic backup is altering the functions of the brain. And in some areas, there is structural alteration is also found in the brain. So from an Ayurvedic platform, we view the functions of the body in a different plane. We have a concept of three doshas, that is Vata, Pitta, and Kapha. To summarize its functions in artistic kit, the functions of Vata or impairment of Vata leads to hyperactivity. It leads to stereotypic functions. It leads to craving for the sameness, or it leads to attention deficit, and all is responsible due to that impairment in functions of Vata in an autistic kit. Impairment of functions in Pitta, it's more an aggressive factor. So temper tantrums, everything, that aggression, lack of emotional reciprocity, everything is attributed to the derangement of functions of Pitta. And the third one, Kapha. It's actually the maintenance of social relations. The craving for solitude is attributed to the functions of Kapha. And the slowness of the Agni, the slowness of the digestive functions, everything attributed to the functions of Kapha. So the baby is having defective functions, and digestive abnormalities are usually a part of that syndrome. So in our science, we view autism as an imbalance in the functional level of these three doshas. And the degree of imbalance differs in each and every child. Some babies will be presenting with more imbalance in the Vata type, so that the baby will be having more hyperactivity, more stereotypic pattern will be the clinical feature. Some babies will be presenting with an imbalance on Pitta on the dominant side. So he will be having temper tantrums and so on. So he will be more aggressive. Some kids will be presenting with derangement of Kapha. So he will be seeking a solitude, he will be clumsy, he will be left alone, he prefers solitude, and that will be symptomatic. So we analyze the symptom of the child based on our concept of dosha. So our diagnosis will come like, baby is having autism, but it's more on predominantly Vata type or more predominantly Pitta type. So the management comes accordingly. A little bit on the concept of acquisition of knowledge or perceptive skills as per from the Ayurvedic platform. From our concept, it's not the function of sense organ to perceive the sensory functions. It's a function of mind, and mind commands the sense organ to be in the contact with an object and perceives it. For example, even if the baby is having a good auditory capacity, baby's hearing capacity is very nice, he is able to hear all the sounds which we are speaking, but the baby is unable to interpret the meaning of that sound. So even if the baby is able to hear all your verbal commands, he is unable to process that commands into its meaning. So his receptive language is very low. He is understanding most of our gestures, most of our emotions he is understanding, but he is not understanding the meaning of our commands or words. That's a cause for reduction in the receptive language of the baby. If the receptive language is reduced, evidently we can't expect an improvement in the expressive language. So when we are trying to improve the communicate the skills in a baby, our main focus should be in improving the receptive language. It's vain to give a stress for training their expressive mode. If we can improve the receptive language, evidently after a period of 3-4 months, baby will evidently show an improvement in the expressive skills. So as a part of workout, when a baby is with you, you should be thorough that baby is hearing properly. Usually Bera will be helpful in that. Then beware of the genetic abnormalities which mimic the autistic spectrum disorders like Fragile X or tuberous sclerosis. Blood metabolic screening is mandatory, and it's safe if you have an EEG workout. Then developmental testing, usually fine motor development delays are associated with ASD. So a developmental screening is also nice. Blood level test is usually done as a routine. So our management protocol. As I said earlier, we first and main foremost importance is given in correcting the digestive and metabolic errors which is happening in the baby. We correcting the gut leaking. The gut is leaking out into the system without proper digestion. That's the reason behind this gluten sensitivity, casein sensitivity and all. And apart from clearing that gut leaking, our job is to clear out that metabolic waste which has already accumulated in the system prior. So clearing out the metabolic waste or detoxifying the body, then after detoxification, we should aim in improving the gut mucosal immunity so that no more gut leaking is going to happen. If it's having a genetic backup, it won't be possible with one treatment. We have to try upon it constantly. Then be sure that baby is on diet regulations, and as narrated by the prior presenters, due importance for the physical exercise are given. Then we try to maintain the equilibrium of our doshas. Then correction of the functional level of mind. And another our concept is methya rasayanas, what we call. There are several drugs that has an ability to work in the dendritic branching and myelination capacity of the neurons, which can improve your functional level. That is what we call it methya rasayanas. Certain drugs are having a site of action in certain specific areas. For example, I can narrate that Shankupushpi or Clitora ternata, what we call it Vella Shankupushpa, is having an affinity or target site at the behavioral area and so on. And each child is unique because every autistic child is unique. You can't generalize a treatment schedule for each and every kid because we analyze the kid having a specific dosha dushti, which is not equal to any other kid in that spectrum. So that each doshic imbalance in each child is different, and even in the same child, in different stages of the disease, it differs. So that management protocol should be tailor-made for each child. It's personalized medicine. Diet regulation is mandatory. Avoid artificially preserved and tinned food. Then avoid anything and everything which is heavy to digest. Which you feel it is heavy to digest, avoid it. Especially heavy proteins to be avoided other than the gluten-free, casein-free diet, like cashew nuts, groundnut, and etc. causing issues. Then overeating also should be avoided. Then coming to management, Ayurvedic platform of management, we aim at the purificatory measures to detoxify the body, like emetic drugs, then purgatives, and medicated enemas are there, which work upon the judicious administration of the clinician. Then Panchagama therapies are well advised. More than internal medication, we give due stress for the external therapy in managing these kids. These are some of the Panchagama therapies. It's very baby friendly, and the kids usually cooperate with this. This is one among the procedure. We call it as Shirolepa. Is usually advised in conditions of hyperactivity. Another procedures on the right side, it is nasal instillation of medication, which is evident to improve the functional level of mind. Cognitive function will be evidently improved with that. Just going through a single case study. This is Yadu Krishna. It's 5 years. And after a period of infertility, a couple conceived at the age of 40 years. And he was a drummer in the temple. Lady has pregnancy-induced hypertension and well managed with antihypertensive drugs. It was a full-term delivery, and baby had no issues at the time of delivery. Sound.
യദുവിനെ വാലടച്ചിട്ടിങ്ങനെ താഴെ വരും.
This is mother. Can see. The other is father. He has an affinity to put his little finger into that electric socket. See how he is trying.
യദുവിനെ വാലടച്ചിട്ടിങ്ങനെ താഴെ വരും.
So severely hyperactive. He is trying to climb up the window and just dropped out after that. So complaints of hyperactivity and temper tantrums are the family attachment is nearing zero, failure to develop peer relations, doesn't respond even for the name call, lack of socialization or emotional reciprocity. You can see that agony in the mother's and parents' face. This is his blank stare, and the other one is his smiling face after the treatment. See, this video is after treatment. See, now here he needs the support of his mother every time. See the social smile. So now after 3 months of treatment, he is responding to name call, can follow simple commands, language has improved, strong eye contact is maintained, and family attachment has improved a lot, which has brought a smile in the parent's face. This is part of a small research conducted in our center. It's a 60 days treatment course. Patients diagnosed with DSM-4 criteria was taken into the study. Having a CADRRE score above 30 were included. And mental retardation and vision impairment were excluded from the study. And assessment tool was CAS and ATTEC. Apart from the CAS, we usually used autism treatment evaluation checklist. It's a parental scoring sheet, and I believe that parents can evaluate the child more than a clinician. So apart from the CAS score, we keep a parental scoring. It's a 15-minute parental scoring system, and we can get improvement in socialization, behavior, and different aspects of autism in that. As narrated earlier, it was structured under a black box design. Black box design is especially advised by WHO for conducting a research in traditional medicine, so that we include all the procedure therapies and internal medication in a box. The box as such is delivered to the patient. We won't comment that which medicine work better or not. It's just a box, and it's given impartially for all the patients. This is the improvement in ATTEC and CAS before and after treatment. That average ATTEC score was 77, which is reduced to 62.6, and a CAS reduction from 35.9 to 32.8 was noted. And from the ATTEC, we can compartmentalize the result. Like in the speech and language areas, there was no much improvement with this period of 3 months. Whereas in sociability, we could get a marked change. You can see in the sociability scale, there's a marked improvement but speech area reacted very slowly. And sensory and cognitive awareness and the behavior areas were responding very well to the protocol. So in recognition to our clinical results, District Panchayat Trivandrum is funding us with a project called CADRRRE, especially designed for Ayurvedic management of development disorders in children. From 0 to 12 years, we have a main center at Government Ayurveda College Trivandrum at Pujapura Women and Children Hospital, having a bed strength of 50, and we have 4 peripheral centers at Varkala, Parasala, Palod, and Keervila. We are running on that project. Along with that, it's an integrated approach. We have speech therapists, physiotherapist, behavior therapist, and Panchakarma therapist working with us with Ayurvedic experts in the field. So it's, we are in the line of integrated management, and it's giving very nice result. So I conclude like, let us join hands for a better future. Thank you. Thank you, one and all.